We have schedules, you have chaos. You know she's wasting her talents down here.
Victoria is a big girl. She could make
In this scene, it kind of puts it down a little. And I think that is a fact and a reality of medicine, where, if you're not involved in the medical world, you probably see all doctors as equals, as cool, as having like very important roles, which is very true. But there is like this hierarchy of like, hey, if you match into this specialty, then you're, better, or what you're doing is more important. And there is definitely at least a idea or vibe from the older days, and it still exists, but particularly in the 80s and 90s, and it still exists, but to a lesser extent today, where surgical specialties will think they are better than like primary care or pediatrics or emergency medicine because they get to, go in and do something that is almost godlike, right? There's amazing surgeons that are friends and whatnot, but there was this old stereotype that still some of those components still kind of seep into the mentality around medicine today.
I mean, for us ER, we do get ragged on a lot by other specialties because we interact with every specialty. I would choose
Mm.
and the reason I chose is because we see everything. We see GYN, some surgery, some ortho. We get a little bit of everything. But it's not just ER. Like, the surgeons will beef with internal medicine. The surgeons will beef with GYN. The GYN, people like, the hospital. So whoever you interact with, you're gonna bump heads because we're all doctors, but we all kind of train kind of differently. We have different like
Right, right.
things we focus on. If you're a cardiologist, you care more about the heart versus the kidney. So if there's a treatment plan and it has a cardiac and a renal issues into it, you may not agree on things. And so I find that whoever you are interacting with, especially you're gonna bump heads with.